My name is Jason Schuster. I'm a doctor of physical therapy. I own Intricate Art Spine and Body Solutions. It's a continuing education company teaching other doctors how to do a couple things. This is part 2 of our vagus nerve stimulation to improve men's and women's pelvic health. This is a clip from our online dry needling 2 class. Check it out. We have an online dry needling 1, an online dry needling 2 class, and a bunch of online nutrition classes. Check them out on our website, intricateartseminars.com. This is from one study from 2023, you guys. It was looking at vagus nerve stimulation and sacral nerve stimulation for inflammatory bowel disease. So this obviously can be used specifically for things like inflammatory bowel disease. If it's helpful for inflammatory bowel disease, you guys, it's helpful for mental health and every other part of our health, because if your intestines are inflamed, our gut microbiome, the bacteria in our gut get dysregulated, and the bacteria in our gut are responsible for they themselves produce a huge amount of our hormones and our neurotransmitters. So there's specific bacteria in our gut, you guys, that produce specific things. One type of bacteria produces serotonin. 95% of our serotonin is made in the intestines, you guys. It's not made in the brain. One type of bacteria produces ACH, another type produces dopamine, and they all produce different levels of these things depending on what types of bacteria you actually have in your gut, what types of food you're eating. Eating processed food absolutely destroys your gut microbiome. Anything with glyphosate in it, which all non-organic stuff is going to have a lot more glyphosate, that absolutely destroys your gut microbiome. There's tons of things in today's society that destroy your gut microbiome, like most things, I guess. And if your gut bacteria is off, your mental health is going to be off, your physical health is going to be off. And believe it or not, you guys, vagus nerve stimulation, this has been objectively studied, is an extremely helpful way to regulate your gut microbiome, because it's regulating the autonomic nervous system. So this is the whole concept of the way that I think about needling, is that you don't need to think about treating the specific condition. If you think about treating the autonomic nervous system itself, you're always going to be led to the area of primary complaint. But that keeps you from just looking at the area of primary complaint and keeping your mind open and thinking about, okay, unless there's a specific mechanism of action, and even if there is mechanism of injury, even if there is, you still want to treat them this way. You want to restore as much energy to the autonomic nervous system and as much homeostasis to the ANS as we can to allow the brain and body to heal themselves, right? Because we're not removing the inflammation from the body. We're stimulating the brain and the body to stop producing so many inflammatory proteins, right? So it's really, really cool. So this study, just like I mentioned a couple minutes ago, you guys, so we talked about sacral nerve stimulation a little bit earlier, right? So remember, that's in general, they just kind of do an X across the sacrum, S2 to S4, stimulate the sacral plexus. Vagus nerve stimulation, I think if you had to choose one or the other, I would choose vagus nerve stimulation for sure, but I like to do both at the same time because it's super helpful. So they are looking at things in this study, and these are the inflammatory and anti-inflammatory markers that are spoken about across literature, you guys. Stroke literature, surgical literature, dry needling literature, acupuncture literature. There's a whole bunch more stuff that we don't even know about in the body, so just take that for what it's worth. We always just talk about TNF alpha, interleukin 10, interleukin 6, all these ones. There's a ton more that are in us. Most of them we don't even know what they are. These are just the ones that we talked about, right? So pro-inflammatory cytokines, tumor necrosis factor alpha, interleukin 1, interleukin 6, and then there's some other ones that people don't hear about as often, like interleukin 18. So needling and vagus nerve stimulation reduces the amount of pro-inflammatory markers, so it's reducing the actual inflammatory proteins. And it's also and this is the really neat thing about needling, you guys, and this is why it's so much better than any pharmaceuticals. Pharmaceuticals act on one or the other. They may try to reduce pro-inflammatory markers or elevate anti-inflammatory proteins. Thoughtful needling and vagus nerve stimulation does both at the same time, because it's not acting on a symptom or on a molecule. It's acting on the nervous system itself, and that changes everything. That's why this is such a much more powerful treatment than any pharmaceutical treatment that we have for all this stuff, is because it's working on the body as a whole, not on just like one symptom. And the body does not work that way. You can't just change one thing and expect to get widespread changes. You need to change the underlying system that's dysfunctioning, and then everything changes. And that's why this works so well. And it shows it in the literature, you guys. And remember, and we'll talk about this at the very end, but vagus nerve stimulation is FDA approved for a handful of things, and they're studying it for a bunch more things. So not only does vagus nerve stimulation reduce pro-inflammatory proteins, it elevates anti-inflammatory proteins. So some of the anti-inflammatory cytokines, interleukin-10, there's some pain-killing medication that works with that. And tumor growth factor beta is another one, right? And that's in the blood plasma. That's how they test for this stuff. Remember, just like we've talked about the whole time here, what they show in these studies, just to confirm that what we've been talking about is more or less correct, is that when people have elevated levels of pro-inflammatory proteins, it's basically always with a concomitant elevation of the sympathetic side of the autonomic nervous system. So sympathetic hyperactivity causes too much pro-inflammatory protein. So that's when the DNA in the nucleosome gets unraveled and the DNA gets expressed in between two nucleosomes. That is how the pro-inflammatory proteins get made. There's actually pieces of DNA that are unwinding and expressing themselves that code for like the interleukins and stuff like that. We want the DNA, that part of the DNA, to get wound back up around the little bobbin so it's not expressed and it's not read and the proteins aren't being produced. So needling is really, you guys, we know this to be objectively true. It's working on a DNA level. It's changing the way that our DNA is expressed to be expressed in a more positive, healthy manner. It's really cool. So per this study, you guys, they're looking at the effects of autonomic balance secondary to treatment, and they say that they're likely mediated by two neural pathways. So number one that they talk about in this study is the direct efferent sacral pathway to the colon and the indirect spinal afferent vagal efferent pathway to the colon. So basically sensory pathways to the actual intestines themselves. In the rodent models, the way that they administered vagus nerve and sacral nerve therapies, you guys, was either direct on the nerves themselves, right, depending on efferent, whatever part of the nerve that they were doing, like the axon of the nerve, and then the other one they were doing with electrodes over the nerve exits, which would be more like we would be doing on our patients, but just with the needle placements, right? So some of these studies are using needles, some of them are not using needles. The studies that both compare the needle use and the electrode use, all of them say that the needle use is better, you guys, which is what I see clinically, which is cool. So this is what they're looking at in this study. Like I mentioned, vagus nerve stimulation, sacral nerve stimulation, both have FDA approval. So does trigeminal nerve stimulation. You guys, we'll talk about that at the end of this PowerPoint. And they've both shown to be extremely safe, very effective, and it's very frustrating that neither of these treatments are a mainstream treatment at all. And it's one of the exciting things that we can do, you guys, is if you can talk to your patients and show and discuss with them why and how this stuff works and do it and show them the changes that get made, it is so easy to have such an awesome business where you're helping so many people, because nobody provides this type of treatment for people and nobody just explains to their patients like what the problem is, what's going on, why this is helpful. And especially if you combine this stuff with nutrition, other types of manual therapy, man, you can make a huge difference in people's lives, you guys. And it's a great way to start a cash pay business or add a cash portion onto your existing insurance practice. I don't recommend using insurance at all, you guys. I know it sucks, but it's just really hard to be financially stable doing that. And that's another thing that we do on our school channel and on our online classes and in-person classes, you guys. So check out that. Our school channel, school.com/CEU, SKOOL.com/CEU, and you can check out the other stuff on our website. This is just the overall kind of review from this study, you guys, right? So this is from that 2023 study. So the results, they took 5 clinical studies, 3 on vagus nerve stimulation, 2 on sacral nerve stimulation. Most demonstrated significant beneficial effects on irritable bowel syndromes, including disease activity, severity of intestinal lesions, and intestinal pain. Both vagus nerve stimulation and sacral nerve stimulation showed decreases in mucosal inflammation, and they showed decreases of sympathetic hyperactivity, leading to a more homeostatic autonomic nervous system. There were no long-term adverse effects. As their conclusions, cumulative evidence from the studies indicates that these therapies safely alleviate IBD symptoms, blah, 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 blah. And then they always say that there needs to be more, better long-term studies. That's true, which is never going to happen with needling because that's just not how needling studies are done. But so overall, good study, you guys. And again, I can just tell you from a decade of experience doing this right now, needling is such an amazing tool to treat inflammation both in the pelvic floor and in the intestines, the stomach, and they're often very, very confined. It's pretty hard not to have like long-term intestinal aggravation without pelvic floor problems. So very, very good one. Here's another study, guys. So this one is the title of the study is Transcutaneous Auricular Vagus Nerve Stimulation as a Potential Novel Treatment for Polycystic Ovary Syndrome. This is also from 2023. So PCOS, this is something that you hear about all the time, you guys. If you didn't know what PCOS is, it's polycystic ovary syndrome. It's a more or less like an autoimmune inflammatory thing that happens. The underlying cause of PCOS is the same thing that causes fibromyalgia, chronic pain, chronic headaches, incontinence. It's just that certain individual women are going to present like this, and certain individual women are going to present as a result of chronic sympathetic hyperactivity just with something else, right? So it doesn't necessarily, it's not indicating a specific problem with the ovaries themselves or the endometrium, like endometriosis itself. It is just the thing that's showing the symptoms of the bigger underlying problem. So it's common disorder, endocrine disorder in women of childbearing age. The causes obviously are not, they say the causes are unknown, but I'm telling you right now, the cause is chronic sympathetic hyperactivity. The cause of the chronic sympathetic hyperactivity is going to be different in different people, but the most common by far, basically the causes of this are eating bad food, not supplementing with the proper nutrients and vitamins and stuff like that, not getting treatments like dry needling that reduce the dysfunction of the nervous system, and just not exercising on a consistent basis. That's it. This is going to be an ongoing series with this video, including other videos from both our online Dry Needling 1 and our online Dry Needling 2 class. You can check them out on our website, intricateartseminars.com.